Hello, my name is David Ellis and I've come to Artemis Hospital to treat my MS. I've come from the United States, California, United States. There are programs closer to the United States, especially California. But I came to India for multiple reasons because I thought this program was better and cheaper. So I've suffered from multiple sclerosis since 2011. And I was diagnosed as a primary progressive MS patient. I treated it with different drugs from Copaxone to Sabri, and lastly Ocrevus. I managed pretty well through the Tisabri period, but the Ocrevus, I noticed the greatest decline in my overall performance and abilities. And things were getting quite worse. Lost quite a bit of physical activity and abilities and started having to use a cane. The treatment that Dr. Pawan and Ragesh, thank you, provide is amazing.
Hello everyone, we have David with us who came here all the way from California, USA for his HSCT for multiple sclerosis. This is, if you see, it is a chronic debilitating illness. So every patient of MS just want one-time solution, so that by which after this we can halt the progression of the disease, and we can do with such treatment we can still get some improvement in the disease, whatever means disability is there, so whatever improvement we can get that. And obviously, so this is the highlight of this program, this HSCT program in multiple sclerosis, is that this is one-time treatment. Even people who have failed multiple therapies, multiple different types of therapies, they can also benefit from HSCT. And we have David with us, who is a case of primary progressive multiple sclerosis, though the results are not that great as compared to RRMS, but still, so seeing the kind of improvement which he had during this transplant phase itself, so we expect a very good recovery in him, and whatever this disability is there with him, so we can hope that this will also go away in subsequent months.
Dave went quite well with our program, the program of resetting and rebooting his immune system with autologous stem cell transplant. And apart from few days of fever, he did not have any severe complications, and he has recovered well. We have objectively seen that his EDSS score has come down significantly also, in spite of not expecting such a fast recovery. We initially had an assessment of 6 and now it has become 2, which is quite fascinating. So our targets are pretty clear. He has told he will go for the half marathon at 1 year.
2 years.
2 years.
Yes, 2 years.
And we have changed the targets. Maybe 1 year he will go for the half marathon and maybe at 2 years he will go for the full marathon. So we'll see him there while he is running the event.
I will definitely share all those experiences for sure.
Yeah.
I think the program is great. And the results have been really positive. I can actually point to some things that I could not do before. I was not able to lift my left leg without helping it. So that is something I can point to in the amount of time I've been here and gone through the program. Just so you know, the program is not easy. And it will be tough on your body and your mind, but living with MS is also. There are things that need to be improved, but the doctors are working on those things diligently. This is my mom. She was my caregiver that came with me. I doubted initially if a caregiver was necessary, but now after going through the 33-day program, I now know a caregiver is absolutely necessary. And I hope by the time this gets out to all of you and you do decide to come here, all the things and the inconsistencies that we might have dealt with have all been rectified and taken care of. Thank you so much.
He has responded very well to this treatment. We wish him all the best for his next course of follow-up in US, which he will be doing and following with us again and sharing his progress with us.
Thank you, Doctor.
Thank you.